Live. Okay, so we're live now. So hey, welcome everyone to our Native Wellness Power Hour. This is week 32 of our Power Hours. I believe today is like around 190th or so Power Hours that we've done. So my name is Jillene Joseph, and I am the Executive Director of the Native Wellness Institute. Today, our topic is about COVID in Indian country. So we're all trying to have these masks on to show that this is one way to stay safe. My glasses keep like fogging up every time I breathe. We're not going to wear them the whole time. We just wanted to show you the importance of wearing masks. But we want to welcome you and thank you for tuning in to our Native Wellness Power Hour. Please share it on your timelines and your other social media sites so that others can join in. We started these Power Hours back in March, actually on March 21st, because this is when the country first started shutting down, the beginning of the pandemic. And we knew that an already traumatized people would be re-traumatized in this pandemic. And so we wanted to do our part and just offer our contribution of offering, positive programming, uplifting programming, something that could be an anchor for our people. And so we came up with the idea of our Native Wellness Power Hour. So here we are, months later. We have never been in a pandemic before. We didn't know how long we would be going, but here we are, week 32, and we're still going. So thank you for being here. Today, we have two awesome human beings that are joining us to share. We have Chenoa Landry. She's actually a staff person with the Native Wellness Institute, and she's leading some of our community health work dealing with COVID. And then we have our special guest, Tiger Scalp King, coming all the way from Northern Cheyenne country, who is going to actually share his story of getting COVID and things like that. And we only have Tiger for about 30 minutes. And so we're going to ask you to go first, Tiger. So Tiger, can you just introduce yourself, tell us a little bit about yourself, and share your story with us?
Yeah, hi, my real name is August. August Scalp King. Tiger's just my nickname. And I don't think nobody knows my real name, but yeah, I'm Northern Cheyenne from Landry, Montana. I'm an athletic director here and a coach. Everybody kind of knows me by. But yeah, let's get to the story. Sorry, these are kind of stuck in my ears here, but trying to see where I want to start at. I probably want to start with when it first hit here. When everything shut down, it kind of shut our sports down, shut our basketball down, shut school down. And at the time, I was kind of, I won't lie, I was kind of, is this real? Is this what's going on? I was kind of watching it because I was traveling around at the time too. So I was kind of thinking I might have came across somebody that was in the airport a lot. But I stayed vigilant, I watched myself, wear my mask, did everything we were supposed to do. And I just kept watching it on the news and kind of watching it as it got closer. It started making its way to Montana. Then it hit the Crow res. So I started talking to relatives over there. I got a lot of relatives on a Crow reservation and asking them how it was going. And I knew it was going to hit here. Just didn't know when, So we still tried to stay as vigilant as we could. Me and my family wore masks, kept sanitizing our hands, stayed away from Billings, stayed away from the city. We'd only go in there when we needed stuff. We ended up shifting going to Mouse City because there was nothing down there yet, and there's hardly anybody there. So I did everything we were supposed to do to not get it, and I distanced myself from people, distanced myself from friends, just to stay safe because I got a grandson that's got some medical needs from being premature. And also my son is asthmatic, and I have a granddaughter that's asthmatic as well. So, and I got two parents that are elders with health issues because, comes with age. So we really watched ourselves. And then school was getting ready to start, and we were trying to figure out plans on how to get school started. And so I was staying on top of watching the CDC and all the governor's reports, everything they were kicking out on the news, and just kind of keeping my own, doing my own research. And all of a sudden one day I started, I thought it was allergies, and my nose started running, and I was kind of getting feverish on a Friday. And me and my son were out getting hay, and I said, man, this hay's got my allergies going. He said, yeah, it happens. And we were sharing a mask just because we was trying to go inside the store. We had one mask. it was brand new, but that's the day I think that's how he got it. And I must have already been infected, but I didn't know at the time. We just thought it was from the hay because I wasn't weak or anything. And then come that Saturday, I started having an upset stomach. And then I was kind of in the back of my mind thinking, am I getting part of COVID? Because it was starting to pick up here on our reservation. There was probably about 9, maybe 13 active cases, maybe 20. I was watching it. I must have been about that much, and I was kind of keeping an eye on it. And then I was like, "Is it hitting me?" And that was that Sunday. I was kind of had an upset stomach, and Monday I was kind of just feeling a little feverish, runny nose. I thought it was allergies again, so I went to work, and I started feeling more sick. So I excluded myself from everybody, and I started telling my supervisor, I said, "I don't feel good," and he was like, "Oh, it's in your head." I said, "I just don't feel right. It's a different kind of feeling I've never had before." And I told him, I said, "I think I'm kind of nervous. I think I might contracted the virus." And he said, "No, it's all in your head. You've been staying away, and just think positive, stay strong." I said, "No, I think because I've never felt that way before with the flu, with the cold, with my allergies, nothing. It was just a different kind of a feeling. I was already starting to feel fatigued. I told him that. I said, I better go home." And I must have been about, I would say 11:30. I came home, and I started, getting tired, and I laid down. Between that time and about 3 o'clock in the afternoon, I was really sick. Like the flu hit me. And by a little later that, around, I don't know, 4 o'clock, hour later, I was super sick. I had fever. I had the chills. I was telling my wife, and she called the IHS. They said, "Bring him in. We'll test him." I got tested, and when I went down, they were asking me, "How are you sick?" I said, "I'm so sick. My body ached." By the time I got there, my body was aching. I was sweating. I just wanted to get that test over with, and of course, that test was no help. They stick that Q-tip in your nose, and I just grabbed that nurse's arm. I was like, "Oh my gosh!" I held that, and anyway, I went through that, and I came home and I laid back down, and I remember I wasn't that tired yet. I knew I was fatigued, and I laid down, and my muscles started cramping up. I was just like, wow, this has got to be. I knew right there I had COVID. I knew I did. I've never felt that sick before. And my wife came in a little later and said the test came back, and you tested positive. Now we got to get tested tomorrow. That must have been after 5. And that night I was so sick with my fevers, chills. I was sweating. My body hurt. My joints hurt. And come that Tuesday, that's when the fatigue came in. I could feel that shortness of breath. I could feel it kind of when I was just walking outside, because I was just doing our research. They said, keep walking, you might clot up. And my family went down, and my daughter and my wife and my son tested positive. So I was just like, I hope they don't get it as bad as I do, So I just kept walking around that day. I'd go for walks with my son. We walked to the crowds, and we walked back to the house. And I'd get a lot of advice from people and relatives in Crow: sit outside, taking that fresh air. So I sat outside in the lawn chair a lot, and I think that's when I thought, I was talking to other people that had it, but they were messaging me on Facebook. They were too scared to let people know they had it, because at that time, if you got it, people were putting them on blast publicly on Facebook, telling them, "Oh, you guys are dumb. You should have stayed home. That's what happens when you don't stay home." I thought it was time for me to put it out there public. I think Jillene, that's when you see my post come out, I went public with it, let them know, everybody know I had it, because I wanted everybody to feel comfortable to be able to say that, so people around them know they need to get checked. Because I was around a lot of people that day. I was around a lot of teachers, and I thought, you guys need to know. I know it's supposed to be confidential, but I wanted people to know I had it, the people that came in contact with me, so they can go get checked. I didn't want them to get sick and have something happen to them they didn't know. At the same time, I wanted a lot of my relatives here to know it was okay and safe to say you have it, because I didn't think anybody would give me backlash at the time. No one did. Everybody's like, "Hey, thanks for coming open and saying it." So people started talking. That's kind of how it got out there. So by that Wednesday, after that came out, that Wednesday came around, I could barely walk. I could barely breathe. I just to go use the bathroom, I could feel that in my chest, and I could feel that shortness of breath people were talking about. And I was even getting nauseated. I was getting nauseated, just like the flu, but worse, 10 times worse. I kept walking, kept moving around, and my son had no symptoms whatsoever. He's asymptomatic. If he didn't test, he would have never known. He would have spread it around. I think my wife and my daughter lost their smell and lost their taste. And then by that Friday, I was so sick I couldn't breathe. They finally took me to the ER to check my oxygen level. And my oxygen level was low that night. And I remember telling my son, well, the doctor told me, he said, if this keeps up, we're gonna have to get you admitted. And I remember telling my son, I said, don't let him take me to the hospital. He said, why? I said, because people haven't been coming home. I said, I don't want to get there. So we gotta keep walking, we gotta keep moving, keep me going. And he said, all right. I said, I don't want to go to the hospital. I said, I know some people that made it back, but there's a lot of people that haven't at that time, because it really started hitting, and people started passing away. And I probably know all of them some way or another. I did work with them with a lot of the work I do, or talk to them, or at a ceremony or something. And I know a lot of people are on the reservation. So, I got my oxygen levels back up. I came home, but I was really sick. And then Saturday came. I had no fight left in me. I was still getting up. My son was getting me out of bed. He's actually helping me out of bed. I never shared that with anybody. He had to help me out of bed, him and my wife, to get me on my feet to walk outside. And I remember sitting outside, and my granddaughters came, but they stayed on the outside of the fence just so I could see them. And I was pretty happy that day. But I tried to eat a little bit. I tried to eat some, I think it was a slushie or a smoothie. And sure enough, that came up. I went inside. I had my son help me walk me to the bathroom, and I threw it all up. And man, I was sick. I laid back down, and I had the chills where you're shaking so bad, and kind of getting emotional right now thinking about that, because I laid there and I was thinking about it. I had nothing left to fight, and some more people passed away, and I lost kind of control of my body. It was so painful and it hurt so bad, and I had fevers and chills, and I didn't have no fight left. I was thinking, is this it? Is this how they go? And I couldn't breathe. And I was trying not to show my family that, because I didn't want them to worry about me. And I was just laying in bed, and I remember almost kind of tearing up a little bit. And I asked my son, I hollered at him to come in here, and he sat at the end of the bed. He said, "You don't look good, Dad." And I said, "Yeah." I asked him to take me for a ride on that Ranger. I didn't tell him why. I told him, I said, let's go for a ride on a Ranger. And he helped me. We got in the Ranger, and in reality, in the back of my mind, I was taking my last looks. I was kind of looking around, because that's how weak I felt. And that's how much pain I was in. I was just, so we drove around the place, and I was just looking around, and I was thinking to myself, this is it, And I ain't lying when I say that. I thought it was, because only the people that probably went through that know how I felt. And I came back home, and I laid down, and I didn't know what to think. I didn't know what to do. You're so weak, you have no fight left in you. You try to fight, but you try to think of your family. But so I started looking at it as positive. A positive solution to that. I thought, well, I just lost a son and lost some relatives. I thought, well, if this is it, hey man, you'll get to see them. So I don't know what I was thinking. It's an ugly feeling. Finally, my sister called. She must just had a notion to call me, and she said she had that brother sister thing. She said there's something not right. Called and checked on me. They checked my oxygen. It was really low, so she called Crow Hospital, and I think he might have pneumonia. So my wife took me to Crow, and when I walked in there, that's the first thing they did, X-rays, and that lady said, "I think you have pneumonia." The doctor wasn't even within 15 minutes. She came back in. She said, "There's nothing I can do for you here. You got pneumonia in both lungs. It's just, we can't treat you for that here. We're sending you the billing. Is that okay?" I was like, "Yeah." And she said, "I got to get your oxygen level up first before we get you on the ambulance." It's okay. And I remember my son texted me. I texted him. I said, "Hey, I got to go to the hospital now." So he said, "Hey," he's texting me back. He said, "You got to fight, Dad. There's he put all my grandkids' names on it. He goes, this is what you're fighting for, and you got one that you haven't even seen yet." He said, "I want you to you got to keep those guys in your mind." And I said, "Okay, I will." I said, "I promise I'll fight through it." And I told my wife, and she was pretty emotional. I told Lynette, she told me the same thing. you gotta fight through this. And I would admit I was kind of scared. I was like, man, I have to go to the hospital. I never rode to the hospital on ambulance before in my life. And I went to Billings and I got up there and it must have been about 3 o'clock in the morning, 2 o'clock in the morning, something like that. That doctor came in. We were talking. He said, "I'm glad you came in." He said, "If you wouldn't have came in, you would never made it through the night." I was like, "Wow."
Wow.
Then they said, "This goes both ways." He said, "You're either going to come out of it or you're not." He was straight up with me. I'm glad he was straight up with me, but he said, "Some people come out of it, some people don't." He said, "But and if you can't get your oxygen level up, we're going to put you in ICU tomorrow." And I said, "What's that?" He said, they put you on ventilator." He's telling me all the processes. Like, wow, okay. But lo and behold, I had a lot of people praying for me. I went to sleep and I kept thinking, I'm not going to go in the ICU. I'm not going to go in the ICU room. And I had some friends that had it before. I said, "Don't let them sedate you." I said, "Okay." He goes, "No matter what, Tiger, don't let them sedate you. Just fight through it." He said, "It's going to hurt, but fight through it." I was like, "All right." So when they came in that Sunday, I started, I think I started coughing up that phlegm from the COVID pneumonia. And it was almost uncontrollable and it started hurting. And that doctor said, "Well, we can sedate you and put a vacuum there because it's going to be really painful." I was like, "Nah, man, I'm good. I'll just write it out." And that was one of the most painful experiences of my life, other than being on oxygen, hooked up to that machine. But the good thing is I never got no fevers after that, but I was just constantly coughing and coughing. That stuff just kept coming up. That was getting kind of scary. I think I was on my hands and knees at one point. But finally that evening it calmed down a little bit, but I coughed a lot of it was green. There's all kinds of colors. I ain't gonna lie. It was like even blood. But my chest hurt so bad. My lungs hurt. My shoulders hurt. And everything just hurt. I was just in so much pain. All they would give you was aspirin. And I think they finally gave me some painkillers and my IVs. So I had so much IVs hooked up to me. I had machines hooked up to me, and I forgot about that. But I was hooked up to all these wires all over me because I had to unplug some stuff and carry everything with me when I tried to use the bathroom. And I was still pretty weak then. I was still barely getting to the bathroom. By that Sunday night, after I coughed all that stuff up, I could feel some energy coming back. They checked me and they said, "You're going to look good. I don't think we have to send you to ICU." And I was like, "Oh my gosh, yes."
Good.
And then when I said, "I don't know, if you guys try to send me to ICU, I'm walking out that door. I'm not going to do this." But Monday was the same way. I coughed and coughed, and it was probably one of the most painful experiences of my life, coughing that stuff up.
Wow.
So when I talked to some of my friends that been in there that was after me, we were sharing that, and it's just it's traumatic, it's traumatizing, they're feeling the same way. And I seen some post on my or comment on my post I had earlier today, and they were talking about their PTSD from it, and they're still on oxygen. I was luckily that Monday, I don't know, I coughed a bunch of chunks out, and it seems like my energy and my everything came back. So I don't consider myself lucky. I kind of consider myself fortunate. And I was talking to Annette on the phone. She goes, "Man, you look a lot better. You look a lot healthier." And I was like, "I feel better." I actually got up to use the bathroom, and I told him I was ready to shower. I was being roughed it for about 2 days. I just kind of wiped my face off, but I was ready to shower, and I got a little bit of my appetite back. And I must have got more of it back because I remember making my sister bring me some Wendy's cheeseburgers. And I said, "You need to bring it to me now." And she goes, "Well, they have food there." And I'm like, "No, I want some cheeseburgers." And she goes, "Geez, this guy must be feeling better." She posted, "I guess my brother's feeling better. He's arguing with me on the phone." But while you're in there, you get all these texts, all these phone calls, and I limited it. I put a password on it just because it's tough to breathe and it's tough to think we're in there. But at the same time, you get emotional and you think about your family, because my mom would call and she'd almost cry talking to her, and my dad would call and he'd get all choked up, and it'd make you choke up, because you don't want to see your parents like that. Mm-hmm. And then, you talk to your wife, you talk to your kids, and then you see how bad it even affects your family. Mm-hmm. I was happy that my wife just got mild symptoms and my son had no symptoms, and my daughter, she ended up to the ER a couple of times to get some IVs in there to get fluids, but nothing too major after that. And she was pregnant, so I was I think I
Oh,
was more worried about them than they were worried about me, and I didn't want them to worry. I didn't want anybody to know what I was going through, so I wouldn't share it with them because I didn't want them to feel the pain with me, because I knew they were worried enough. And so I think Wednesday they were trying to send me off to the next town over because they only needed to make room because I was coming out of it so fast, and doctors couldn't believe how fast I was coming out of it. I was just happy. I was like, "Can I just go home?" And they said, "Well, you're going to need oxygen." And I have a sister that's a nurse. I have in-laws that's nurse, and some more family that's nurses here. So I'm fortunate enough to have family that's in the medical field. So we're working this out to get oxygen here to the house, and they started testing my oxygen. I passed their test that morning, so they took me off oxygen,
mm,
and my oxygen levels are staying up. And so if it stay up throughout the day, they might just release me without it. So they did some more tests on me, and I passed those. I just kept looking in the air. I was like, "Come on, buddy, up there, if you can help me out here a little bit. I want to get out of here. I don't want to go to Columbus. I don't want to go to Red Lodge. Places I'm not familiar with." And they came in and they said, "I can go home. We're gonna let you go home." I said, "All right." They said, "We canceled the orders on oxygen. We're gonna let you go home on conditions that I sign this paper that anything goes wrong, I come right back, not to Landry or Crow, straight to Billings." So
mhm.
they never let anybody go home that fast before. They had all these conditions. So we had long talk, and um, my wife was pretty happy. She goes, "I'll come get you right now." And my family came with her, and that was really good to see him. Got wheeled out in a wheelchair, but I wasn't 100% when they let me go.
Mhm.
I was trying to show them I was 100% just so I can get out of there. I was I was too just getting off the wheelchair and walking in the car. I was breathing hard,
Mm.
and I remember I came home. I could still feel my body aching. It was so sore and exhausted and run down. It was unreal. I played a lot of basketball at the time, a long time ago. I mean, back in the day, and did a lot of hard work. I think I was out logging some days, and my body's never been that wore out before.
Mm.
And I got home. I know I was happy to be home, and I had a lot of people writing to me that were going through the same thing and asking me um, what helped, what didn't help. I know while I was going through it, when I was that sick, nothing helped. I won't even lie, man. I tried everything. I tried all our traditional medicines. I tried Tylenol. I think the only thing that really helped me was Tylenol with fever. But at that point in time, that sickness, nothing helped. I mean, like I said, I tried everything there. I was just taking all the medicines, and I was taking all the traditional medicines, and I was curled up in a ball, just sweating. I think the only thing that helped me through was a lot of prayer.
Yeah.
I did a lot of praying, and when I had a traumatic event in my life before this, and I was kind of I was I was mad at God. I was step back from that. I was a strong praying man, but I was finding my way back. And I went to Sundance just before that to kind of break bread with him. That because that's our way. As natives, that
Yeah.
it's our way. But I think a lot of prayer goes through there, and at the same time, when you're in there, I think the only thing that saved me is they gave me. I didn't go through the plasma treatments. I didn't go through none of their different. I don't want to be their guinea pig. I
Yeah.
just stuck with their steroids, and I took a lot of advice from a lot of different traditional friends that called me. They wrote to me on Facebook, and I just stuck with what they said. Just go through it naturally, and we'll pray for you on our end. Trusting the Creator and trusting us will get you through it.
Mhm.
I said, all right, and I did, and I'm thinking that's what got me through.
Yeah.
I'm hoping. I wish they would have helped everybody else get through there. And at
Yeah.
the same time, you're in there fighting for your life, but you can't choose your destiny, your destination. Because I know some people said they didn't even fight, they didn't get through. I was like, no, I fought, but there was a point there where I pretty much thought it was my time.
Yeah.
I was already thinking that way. I was already preparing myself that on the way up on the ambulance. Um, I
Mm.
thought, well, this is it. This is probably my last ride, and so I was trying to stay at peace with it because we're taught as natives that when it's your time, it's your time. There's nothing you can do about it. Because I
Mhm.
lost a lot of relatives in my life, and I was saying no matter how they're taken, you don't question it. You don't question the creator. It's just their time. We're here on
Yeah.
borrowed time. So I was like, all right, my time must be up. But it wasn't, fortunately. So I look back on the way people talk and handle it in a negative sense.
Yeah.
Oh, those guys just gave up. Oh, they just did this. Oh, no, man. It's just, it's either your time or it's not.
Mm-hmm.
I guess my work here wasn't done yet.
Mm-hmm.
That's just the way I look at it.
Mm-hmm.
No one chooses to go out and get COVID.
Yeah.
Like I said, I did everything possible I could do not to get it. And I looked back as far back as I could, and I don't know where I got it. I don't. And I'm thinking I'm the one that brought it home to my family. But I do, at the school, I see a lot of people. And when I go uptown, people come to my pickup. And I do try to roll my window up. But I don't want to be that guy either,
Yeah.
I don't want to be that guy and not talk to anybody.
Yeah.
But I think I kind of know where I got it, but I don't want to point fingers and blame because it's like a virus. And I think I talked to you guys earlier today. It's like a cold, anything else you get, it's just there. Because even being a basketball coach, you see your players, or I work at a school, if they get the stomach flu, you're like, it's just a matter of time before it gets to you, or the strep throat. I'm like, oh, I'm sanitizing my hand, but it's coming, it's coming. And that's why I look at this virus. And there was a person I talked to, some people were saying, they gave it to you, get mad at them, cuss them out. I'm like, no, it's just, when you go out in the public, you talk to people, that's your chances of getting it. Your chances are when you're out there. So, but after I got home, I drink a lot of Barrett. One of my good friends, Dita Newbreast, she was telling me how to make it. She was in contact with me. All right, so I was boiling it, and I did a lot of that. So I'm gonna say that helped when I got home. A lot of that, a lot of Sundance cedar.
Good.
That's kind of what I did. And there was people telling me to take Motrin. They said, no, it's gonna make it worse. Just take Tylenol. And the doctor said, no, it works both ways. So I don't know. I did both. When my pain was getting bad, I was doing a lot of Motrin. So I was home for a 20-day quarantine, and I couldn't even walk 50 feet to our garden without holding on to a post after I got home. I was in the hospital almost 1, 2, 3, 4, about 5 days, 6 days, something like that. 2 days after that, I finally started walking around. I thought, no, I need to get around. I need to move around. And I remember getting over there to watch my wife, because she was showing me all the stuff that was growing in there. In that little time, I was kind of probably about 2.5 weeks, 3 weeks, just down in my bed, and in the hospital. But when I got over there, I was hanging onto that pole and I couldn't even breathe. I was like, wow, this is rough. And I sat down, and because my son put a bench there, and I was watching him, and I was looking at the walk back up the hill. It was only like 50 feet. And any other time I could walk right up there. I walk back and forth. I put that fence up around that garden. I just took a deep breath and I started walking back up to the house. And by the time I got to the house, same thing, I was hanging out to that post. It's rough. It's really rough.
Wow. Well,
so
gosh, Tiger, thank you for sharing your story. And I know you have to get back going. Tiger, I just asked him like today, hey, can you come be on our show?
I know.
Because
I was trying to think of what I should say,
Well, this was perfect. It was awesome. And I know your post was about some of the still lasting symptoms that symptoms, I guess, that you're experiencing. So
yeah,
just like the people that are tuning in today all around Indian country, we know that tribal and urban communities are still being hit hard. Like, what words of encouragement or advice would you give to people that are tuning in today about keeping safe from COVID?
Man, I would say you got to wear your mask all the time. Keep sanitizer with you, and follow the CDC guidelines, and all the guidelines people are setting in front of you. I think that has to work the most, because we had a lockdown here. When it hit here, it hit hard. It just skyrocketed. People lost their lives in a 2-week span there, just snap of the fingers, and I was just one right after another, and that it traumatized their community. It traumatized a lot of families, because I went to some funerals because I knew these people. It's like one right after another. Some are relatives, some were friends, and some were big impact and influence of my, mentors in my life, and it just happened. And you can do the best you can. Stay home if you have to. Keep your distance. I know it's tough staying home, but just to stay home, and if you do get it, they got medicine for you. Take your medicine, stay healthy, keep moving. And if you get it as bad as I do, I mean, just you got to fight through it. Do what you got to do to get through it, and listen to your doctor. Listen to everybody. Everybody that's a professional in that that realm of COVID. So and the positive thing is, and most of all, just pray. And I think I burn a lot of cedar now, a lot of sage. I say sage kills some of those viruses. It's kind of what I did. And just stay vigilant. Mask up all the time. Mask up all the time. I wear a mask all the time. I was one that wouldn't wear. I want to lie. Every now and then I take it out. I was like, I got breathing this. Glasses are fogging up. But now I got one in each pocket. I got them all the time with me.
Good.
I got hand sanitizers in my truck. I got hand sanitizer in my pocket. But that's kind of, and just be ready mentally, because it can affect your family. It can affect you for, taking a loss in your family, or seeing your family members go down. I see a lot of relatives still carrying oxygen around. Some are in hospice, and like I said on our post, it's about a month and a half later. I still have a hard time breathing. I still have fatigue. My muscles still hurt. My joints are sore. And believe it or not, I mean, I was kind of one of the blessed ones with no gray hair. I'm getting a bunch of gray hair, and I think it's from that COVID,
Wow, yeah.
Yeah, this happened just recently in the last couple of months,
Wow.
So it does age you, and it's a very negative feeling that comes over you like a black cloud. When you get that fatigue, it's from that COVID, because that COVID feeling totally different than any other sickness you get.
Wow.
So when I get fatigued, I was telling my wife and my son, I was like, man, this is that COVID again.
Yeah.
It's just a negative vibe, negative environment.
Yeah. Wow. Well, Tiger, we're so glad that you came on today. We're so glad that you healed through this. We were praying and rooting you on from afar,
Yep.
you and Annette and the family. And, I just appreciate you and respect the work that you do for your community and for all of Indian country. Like today, you did a service to Indian country and beyond, all the people that are tuning in for the Power Hour. So thank you for that. And I know you got to run back to go back to work. He was at work.
I know.
He rushed home.
I know. I dropped everything, flew over here to get logged on. I was trying to sit here and log. I mean, and you've probably seen us on that camera trying to get everything set up.
Yeah, thank Annette if she can hear in the background. Thank you, Annette, for
Yeah, she's on my phone right now listening. Hey, but thank you guys too, and Jillene, thank you, and Native Wellness Institute for all the donations for that suicide awareness walk for my son.
Oh yeah, of course.
So appreciate that. Went a long ways.
Good.
Out of my heart.
Yes, we were happy to do that. All right, take care, Tiger. We'll see you soon.
Thank you, Tiger.
Yep, it was nice meeting you. Okay, see you later, everybody. Bye.
Okay,
Let's see if I can log off.
Yeah, awesome. Yeah, Tiger has to get back to work, so we wanted him to share his story first. So that was so awesome. And Chenoa, we wanted to just kind of like do some COVID 101 and talk about like what it is and how you get it and what happens if you have symptoms, testing, just all that kind of stuff. And so just so the viewers know out there, if you're just tuning in, Chenoa actually works for the Native Wellness Institute. She's a community health worker, and she's specifically like doing COVID work. And so even before that, she was, doing her own COVID research and, all of this kind of stuff. And so I call her our native Dr. Fauci, our Dr. Chauchi.
Yeah, I wish I had the career that Dr. Fauci has, but thank you. Appreciate the.
Yeah, so she's not a doctor, but she goes to like all these medical trainings, reading like all of this kind of stuff. And so, Chenoa, can you just start out by telling us, like, kind of going back to the basics? So think about someone who might be tuning in today that like doesn't know anything about COVID. Let's kind of start there.
Okay, so COVID-19 is the name comes from coronavirus 2019, which is when the year that they first started seeing incidences. I apologize for the background music, as I was in a meeting earlier today and they were talking about what is something that you say now that's normal that would have been weird in 2019. And one of them is that we're all home during the day, during the week, because everybody's working, but we're all working and going to school from home. So sorry for the background, but it's also, but they've shortened COVID-19, or they've condensed it so that it's all in one. And COVID-19 is like the the actual virus is a coronavirus, and coronaviruses have been around for a long time, but this particular strain is like the one that's causing everyone to be really sick. And one of the things that I keep hearing from folks is that they don't understand why the science keeps changing or the messaging keeps changing. Because in the very beginning of the pandemic, public health officials were saying don't wear a mask because and one of the reasons was because of the mask shortage. So the US, we didn't have enough masks for our health professionals who are working directly with patients who have who are being treated for COVID. And so they were encouraged because people were buying masks and like hoarding them, and there weren't enough of this supply. And so they did. So the science is, it's not really changing, but the thing about science is that we're always doing research. And so scientists, you know, there's hundreds of thousands of scientists around the world right now that are only just studying this pandemic, and they're studying the virus and how its effects on the body. And so that's why the messaging might change, and it'll probably change again at some point. But one thing that they did see was that if everybody wears their masks, if we all wear it, it keeps our like the tiny little spits that come out when we talk or cough or sneeze, those are called droplets. There's bigger droplets, and there's also even smaller droplets that we don't even see. And those are, it's called when your breath is aerosolized. And so like if you are wearing a mask for a long time, like this happened to me on Saturday. It was cold outside and I was wearing a paper mask. So I have a cloth mask, and I have the KN95 mask, and I was wearing the KN95 mask on Saturday, and it was cold out, and so I was breathing out a lot. So there was like condensation on the outside of the mask. And because my body inside was warm and I was losing heat. And so so we don't even see the moisture that we're breathing out. And so when we talk, we're expelling air and inside and droplets all the time, and we don't notice. I mean, you don't have to be talking like what's his name, Daffy Duck. all the right, that's not everybody spits when they talk. So I know that we have that image in our head of like, now it's like you can never get it out, never get the image out of your head that we're all spitting while we talk. But those are what's carrying the virus. And so when they're talking about a 6-foot distance, they're talking about the distance that your droplets are going from your person to another person. But there's no like I guess golden rule, I don't know if that's a thing, but about that 6 feet, it doesn't like go 6 feet in the drop. It's just kind of like a curve down. And so they've done other studies. So the most recent study that I've seen, which came out I think about a month and a half or 2 months ago, I think, they're saying it's more like a spectrum. So if you are indoors with another person and you're talking, your chances of exposing each other to the virus are pretty are higher if you're not wearing a mask. So that's why it's important to wear the mask. If you are outdoors and you're 6 feet or more, and you're both wearing masks, your chances of getting it are lower. But then if you're not wearing a mask and you're singing specifically was one of the things where the study noted that the chances are actually higher of spreading, because you know, especially if you're singing from, you can't see, I'm pointing with my diaphragm, when you're singing from your diaphragm and you're like pushing all of that air out. I mean, especially if you're a loud power singer. And this is something like, as a person who enjoys powwows, I enjoy singing, I enjoy dancing, I enjoy watching, I enjoy being at powwows. We as a family have chosen not to be around other folks who are singing just because we don't want to expose each other. And that's one thing that I thought specific for our communities is that we do need to be aware that that's increasing your risk, because especially if you're sitting at a drum, for people who choose to sit at the drum or standing behind, you're pretty close to each other, and you're breathing in and out each other's air. And so that is why, like, if you're gonna sing, probably the safest way to do it would be, they're saying, like, even like you can expel moisture as far as like 10 or 15 feet.
Mhm.
So that 6 feet rule is like, it's just a guideline. It's just like if you're both wearing masks and
Yeah.
outdoors or with good ventilation.
Yeah. I think at the beginning of the power hour, we all had masks on. And so I see people, like, they'll have their mask on, but it's only covering their chin.
Yeah.
Or they'll have masks on, but their nose is out, right?
Yeah.
Or they'll just have it hanging, like
Yeah.
this.
Yeah.
So like, we just wanted to do a reminder, like,
Right. And if you think about it, you're breathing out of your nose. So you need to have your nose covered. And the other thing that is interesting, that another study had come out, was that there's a thing called viral load, and that's the amount of virus that you're exposed to. I think of it as like beads, like, in your seed beads, or your little tiny beads that you're beading with. And like, if you have like one or two, your chance, like, it really affects this virus affects everybody so differently. But the viral load, like, if each of those beads was like a little tiny virus, then you wouldn't have very much. But if somebody grabbed like a full hank of beads and spilled it all over, you'd have so much more. And that's what it can impact how your body deals with the virus. So if you have a lower viral load, then you're not as likely to get as sick. And even wearing a mask could reduce your symptoms. And so that's why it's important, because less of them are like getting in. So when you do wear a mask and you wear it outside, it's also really important to wash your hands before you put it on. And then when you touch only the sides, and making sure that you can maybe adjust it when you first put it on, but it's really important not to keep touching the front, because if you think, this is what's stopping everything, you don't want to keep touching it and getting it on your hands and accidentally getting it on yourself. That was another reason why they were recommending not to wear masks in the very beginning, is because people oftentimes, when you have something new and different on your face, you're like grabbing it. And so they were worried about increasing the virus and stuff, because then you're touching your face and you don't want to touch your face.
Nice.
Yeah. But the other thing that I've also heard is that people are concerned about the like hyperventilating, or not hyperventilating. They're worried about I think I saw something where there's like too much carbon dioxide, and they're afraid of fainting. But just think that surgeons have been wearing masks all day, every day for like over 100 years, and that it just doesn't happen. And so I mean, it's I think that if you're wearing the same mask over and over again, you might get like bacteria in here, but you're only breathing in and out. This should only be for your face. So you don't want to share a mask, and you want to make sure that you're washing them in between uses.
Nice. So there's a question, Chenoa, that came in. So the droplets that you talked about when we talk, so are droplets also carried in cigarette or marijuana smoke? So if we can smell the smoke, are we being exposed? That's a great question. And if you have any other questions, please put them in the chat.
I think that the jury is still out on that, so to speak. I think that they're still researching that. I think about that a lot, but I believe that when you smell something, that's like the molecule is like accidentally hitting your nose, is the way that they describe it. And so that molecule is going to be smaller than a virus. And so my understanding is that It is possible, and they have seen. So it is possible, but it doesn't mean that if you can smell someone's cigarette smoke, that you're breathing in their viruses. You're probably breathing in chemicals from the smoke, also. So, yet another reason not to smoke, so that. But but I did see one study that came out of China where they were they were trying to do contact tracing, and they found that people who had been sitting next to a vent of the air conditioner, and it was recirculated air, and it was at a restaurant. I don't know if I said this, and there was like a table that was right next to the vent, and like 90% of them became infected with the virus, and the person who the person, it was like 5 or 6 out of 8 of them, or that doesn't add up to 90%. Okay. I don't know the exact numbers, apologize, but it was a lot. It was like a higher number of people who were sitting by the vent, and that the one person was like way over here. That's why, like, when I go in public, I'm really like hyper aware of the ventilation systems. And this is what they were talking about with reopening schools I mean, if you think about the state of our education and how low that our people in positions of power have prioritized education for our children, and like providing even just the basic needs, like our ventilation systems in schools is like probably, I don't know if it's the last thing that they think about, but it's pretty low. And that's why I personally have my own concerns about our children being in school, because we just don't know how fast that it spreads.
Yeah. Good question. I mean, good answer. Thank you. So we had another question, but I think it already got answered in the chat. Should I be washing my masks and underwear in the same load?
Hmm. Well,
Somebody said no, and somebody else said, well, just don't mix them up on your face. That was Robert. But
probably. But actually, as long as you're using hot water and soap and putting them in the dryer, like that, like.
Oh, good clarification on that.
Because you do want to, and this is true for your underwears too. You want to make sure you put everything in the dryer. Good.
Yes. Okay. Use your dryer, Rob. No hanging them out. Okay. So Chenoa, so what if I went out to the store and I had my mask on, and then I was walking to my car and someone pulled up next to me, and they were coughing and, all of this kind of stuff. And I feel like, oh my gosh, what, do I have COVID? Like, what do we do in those situations if we think we have it? Or when should we get tested? Should we get tested? Should we quarantine at home? Like, can you just kind of walk through some of those scenarios?
Yeah. So up to 45% of people have no symptoms. So it is really important that we mask up. And that being said, just because somebody is coughing doesn't necessarily mean that that they have COVID. And so I want to, it's really important to like have a good like a fine line of healthy worry versus obsessive worry versus carefreeness. And so if you have been exposed to a known positive person, you should quarantine, self-isolate. So quarantine is different than social distancing.
Yeah, I was just gonna ask, can you like define what those mean?
So like when you're social distancing, that's like that 6-foot distance that I was talking about, 6 foot or more distance, wearing masks, being out, going to the store, like you said, and wearing your mask. And if I'm pulling up to a stop sign, honestly, I roll my window up, because we just don't, the science, like I said, is always developing, and we don't know what we don't know yet. And so I but if you've been exposed to a person who has tested positive, you should definitely isolate, which means you don't go outside, you don't go shopping, you don't like, if they're saying if you have to work, then go out, like people who are um, um,
Essential workers.
essential workers. Thank you. Oh my gosh, I don't know why I couldn't find the word essential. Um, then there are some exceptions. I would say that campaigning on in a campaign, like going out around other people, that's not as, in my mind, it's not essential. But that's just what I how I think of it. And you want to be, even if you can, if you are the only one in the home who has been exposed. So let's say I'm working at a place where I got exposed and I have other people in my home. I want to try to stay in my own room and using my own bathroom. And that unfortunately is not a reality for most of our communities. Like, I mean, in this, I remember hearing stories of my people in my family who got sick with TB because they were sent home to quarantine and got the rest of the family sick. And that's that is really, that's a reality for a lot of us. But the best thing you can do, if that person, you can wear a mask in the house if you can't distance from your family members, and you can just wipe everything down all the time. Anytime you touch anything, if you can, just stay away from other people, and washing dishes really good in very hot soapy water. Washing, I've heard that if you wash the sheets it's a pain, I know, but even taking the sheets out and washing them in hot water or shaking them outside, at least that will, and keeping the windows open if you can, which is going to be harder for the winter months, especially for our relatives who are in states where they're already getting snow. And but we are seeing the numbers in the US as of, I think it was Friday, was the highest day since the pandemic began. And so that is why it is so very important to continue to be vigilant. And I know that we have pandemic fatigue, and where we hadn't planned before, I feel like I had heard public health experts say in the very beginning, we need to be planning for a marathon, not a sprint. And we're like in this marathon right now. I have never run a marathon. I I've run 14 miles, a very slow 14 miles, but I understand. I know the concept. We know the concept of running a really far distance, and we need to pace ourselves. And where my, I guess in the very beginning, where a lot of us experienced fear and anxiety and like the stress and like all of the unknowns, and expecting the news to give us the answers, to tell us the future, and that's not going to happen. That is like taking a toll on all of our like mental health. And now we're like exhausted. I don't know if everyone's exhausted. I'm just saying in general, I think the planet, we're exhausted. And so a lot of people are letting their guard down. And we're seeing that in the numbers. And this is not in any way to blame anyone who got it, because I think Tiger said it really well. Nobody asked to get sick.
Yeah, definitely. Yeah, and actually the pandemic fatigue is part of the reason why we even wanted to do these power hours, right? Just to kind of be this anchor every day, the same time, the same place, offer some kind of, uplifting or positive programming. Today, we're trying to offer this educational programming to help people. We know that, early on, especially like the Navajo Nation, as an example, was hit hard early on. And now what's happening is other communities are like just now getting like their first cases, right? Many, it's hit our family personally, and, communities are on lockdown and things like that. So there was a couple of other questions. One asked, what about ironing cloth masks? Would that heat work like the dryer would work? That was a question. Have you heard anything about that?
I haven't seen any studies about that. I can ask and get back to you. I get on the echo clinics every Monday and Wednesday, which is it's just like a didactic presentation of like the latest research, and it's mostly IHS providers who are on there. But I think we don't really know. What we know is that like alcohol-based cleaners and soap for like at least 20 seconds is what kills the virus. And in my mind, and I don't think we know exactly how hot or how long to kill that it will kill a virus. That's why soap, because the virus has like a waxy or oily covering, and that's why when we wash our hands, I know that's like silly to like it can be silly to like let's wash our hands. You know, it seems like something for a 3-year-old, but honestly, washing your hands for 20 seconds is really what they're saying breaks down that oily barrier and then rinses off. And so I sing happy birthday twice, and that's usually about
How
it's
long
about
to wash your hands? Yeah.
and under your nails too, because we don't know, we want to get all of that, and it's just good good practice.
Yeah, actually, I was talking to someone else about they've always had long nails, and in the pandemic, they've kept their nails short because they heard like, all the stuff that gets under our nails. So I think even that. So there was a question in the chat too about, so what if somebody maybe is an essential worker or they have to take public transportation, like they have to take the bus, what should they do? Like, what are some safety measures they can take?
Well, definitely wearing your mask, carry your hand sanitizer with you. If you have been exposed and you need to quarantine, reach out to your, hopefully in your area. This is the other thing with not having a national strategy is that we don't have resources in every community that is needed. And I fully understand that. And, you just have to do the best that you can do. Which is, like I said, and staying hydrated. You want to make sure you're eating all of your good vitamins, your good vegetables are really, really important. When I recovered from pneumonia several years ago, I asked my provider what was the best thing I could do so that I don't get sick again, because I was hospitalized and it was really, really scary. And she said the number one thing that you can do is to eat well. And she was like, eat your vegetables. And she was like, that's going to be like a protective barrier over you. And that's just good sound science. And if you guys need information and resources, Thosh and Chelsea have a really great website about eating traditional foods and eating for your gut health. And those things are really important because we just really don't know. I read a story in the New York Times early on in the pandemic. I think it was back in April, and they studied 2 women who had come down with the virus. They were both healthcare providers. They had similar backgrounds. They were both young women. I believe they were 27 or 28. They both had a young child in the home. One of them was like a 3-month-old or 6-month-old. Another one was like a 2-year-old, young children. And then they were both married, and they were both, one was a nurse and one was a doctor. And they both had very different outcomes. And so I believe it was the nurse who they were both hospitalized at one point. And the nurse was really, really, really sick and got better and then relapsed. And the doctor, unfortunately, she passed away, and the nurse recovered. It was a very, very slow recovery, but basically, and it wasn't a scientific study, it was a news article, but it was just showing how vastly different, and I think Tiger exemplified that as well, how vastly different that our bodies might react to this virus. And so I also wanted to just quickly send out my sincerest condolences to those who have been have relatives who have perished. I'm seeing a lot of it on my newsfeed, and not just from the virus. I just feel like right now is a really difficult time in our life. And I just want to let you all know that I'm sending my prayers out for all of you, and for all of you who are ill. We pray for you every day, and we pray that that we will get through this and we'll see the other side of this, and we'll be on the other side of this wave, but we just have to get through this.
Yeah, thank you, Chenoa. I can't believe our hour is already up, and there was like some other questions and areas like around testing and,
Oh my
false
God.
false results, false negative, false positive, all that kind of stuff. So I think we need to schedule another one. So we'll get back on here. So the main thing for today, we wanted to just, remind people that we are still in a pandemic, and the winter's coming, the holidays are coming, people want to gather and all that kind of stuff. And, sometimes we let down our guard, and that we still need to take this seriously in order to keep safe, right? So that's what today is about, is just hearing the reminders of wearing our masks and washing our hands and using hand sanitizer, staying home if we can, being super careful if you have to go out and about. So that was the main message for today. We want to thank you all for tuning in and remind you we have an awesome week coming up. Poetry and healing strategies from one of our elders, Avis Archambault. We have a show Wednesday on identity. And then Friday, we have a fun show on Halloween, and there might be some, masks and stories. So tune in on Friday. I hope you have a great rest of your day and week, and we'll see you tomorrow. Thank you, Chenoa, and thanks, Tiger, if you're listening in.
Oo, shabi tubu chan. See you.
Yeah.